Hello, everyone. Apologies for the few-minute late start. We are grateful to see all of you all here. Welcome. It is February 11th, a little after 2 p.m. And this is the Health and Social Services Subcommittee on Appropriations Budget Hearing. Today, we're going to be hearing from on four different budgets. And we're going to take them in the following order. We will do the Office of the Deaf and Hard of Hearing, followed by the Department of Disabilities. Third, we will take MDH Public Health Administration. And last, we will end with the Department of Human Services Overview Budget. And so we will go ahead and start with ODHH. And as always, we begin with our budget analyst first from Department of Legislative Services, Connor Brown. Welcome again, and we look forward to hear from you. Thank you.
Thank you, Madam Chair. Good afternoon. My name is Connor Brown, Policy Analyst with the Department of Legislative Services, here to present the fiscal 2027 budget analysis for the Office of the Deaf and Hard of Hearing, or ODHH. To begin, on page 1 of the analysis, the fiscal 2027 budget for ODHH increases by $69,116, or 6.1%, to $1.2 million. On page 2, Exhibit 1 shows an overview of agency spending in fiscal 2027. Approximately 76% of the budget supports personnel, funding 7 regular positions. The second largest portion, at 9%, is for American Sign Language interpretation services. These services support internal operations, public meetings, and town halls. Moving on to page 3, Exhibit 2 outlines line item changes in the fiscal 2027 allowance compared to fiscal 2026. The primary driver of the budget increase is personnel costs, which are increasing by just under $80,000. Additionally, sign language interpreter services increased by $35,000 due to implementation of the Maryland Sign Language Interpreters Act, which I will get to later. Helping offset increases is the elimination of a contractual executive assistant position. On page 4 is the personnel section. As of December 31st, 2025, ODHH had 4 vacant positions, some of which have never been filled. Regarding these vacancies, ODHH has indicated that they have been kept vacant due to delays in the implementation of the Sign Language Interpreters Act and the statewide hiring freeze. However, ODHH has stated that they intend to fill these positions by the end of fiscal 2026. DLS recommends abolishing one of the vacant positions that has been vacant for more than 1 year. The key observations section begins on page 5 with the licensure and regulation of sign language interpreters, which was established by the Maryland Sign Language Interpreters Act. This bill required the State Board of Sign Language Interpreters within ODHH to establish and publish licensing requirements by July 1st, 2024. After requirements were not published by the required date, committee narrative in the 2025 Joint Chairman's Report requested a report from ODHH indicating that they have published the requirements and explaining reasons for the delay. This report was submitted in June 2025 after ODHH submitted proposed licensing requirements for public comment. However, during public comment, ODHH indicates that they received a high volume of comments expressing concern and confusion about the requirements, with many comments pertaining to the statute itself. ODHH announced in November 2025 that they were pausing development of the regulations, and the governor's office convened a working group to discuss the concerns and any potential changes to the Maryland Sign Language Interpreters Act. DLS recommends adopting committee narrative, requesting that ODHH submit 2 reports with updates on the development of state sign language interpreter licensing regulations. More details on this recommendation can be found in the recommended action section on page 7. At the bottom of page 5 and on page 6 is the second key observation, which discusses key findings from the work group for the deaf, deafblind, and hard of hearing. These findings and recommendations were submitted to the Governor and General Assembly in May 2025. In these recommendations, the work group recommended a new deaf, deafblind, and hard of hearing unit to provide case management services and advocacy, as well as a deaf, deafblind, and hard of hearing coalition of case managers that meets regularly to ensure individuals in the community are being served and served by the appropriate agency. The work group terminates in June 2026, but has requested an extension to expand on charges of the work group it believes have not been addressed completely. And with that, I conclude my presentation, and I'm happy to answer any questions you might have.
Thank you, Mr. Brown. Any questions from members for our analyst? Seeing none, thank you. We will now call upon Director DeBerry and any members of her team to join us at the table. Thank you. Thank you. Welcome back to our committee. We look forward to hearing from you today, and you can begin when you're ready.
Thank you for inviting me for this beautiful building. Wow. So thank you to the chair, vice chair, and our honorable committee members. Introducing myself, I am Usherla DeBerry. I'm the director of the Governor's Office of Deaf and Hard of Hearing. I am truly honored to be here advocating on behalf of the current governor's administration. It's been a privilege to work with the Moore Miller administration to support the deaf, deafblind, and hard of hearing community throughout the state of Maryland. I would like to thank our current DLS legislative analyst, Connor Brown. Thank you for all of your work. We know that it was an immense undertaking to analyze our budget as an office, so we are very grateful as well for the hardworking staff that we have at ODHH, Diamond, and Tanea, who is not here today, but Tanea Brown also was involved. This fiscal year, we have been focused on sustaining the open communications with the deaf, deafblind, and hard of hearing community, and also with the ASL interpreting community writ large. We have achieved this through our town halls and various meetings. We have hosted both of those with and without our advocacy board. The Maryland Advisory Council for the Deaf and Hard of Hearing, or MACDHH, is that board. ODHH has also strongly supported and facilitated the Deaf, Deafblind, and Hard of Hearing Working Group, supporting them in developing their recommendations. If you look at page 4, when it comes to the personnel, the Department of Legislative Affairs, or rather, pardon the interpreter, Department of Legislative Services has recommended abolishing one of those vacant positions that has been vacant for more than 1 year. To respond to that, the Governor's Office of the Deaf and Hard of Hearing, ODHH, respectfully disagrees with the recommendation to again abolish that position, or any one of those positions. Again, for the deaf, deafblind, and hard of hearing community, historically, these individuals and the members of that community have been underrepresented. And they have faced long-standing and really, without fail, barriers to inclusion. Reducing our staffing and the level of individuals within ODHH would have a disproportionate impact on this community and undermine the agency's mission and goal and ability to effectively serve the broader constituents, meaning our Marylanders. Now, due to the statewide hiring freeze, as well as delays and extensions, extensive public feedback that we have received, again, during that public comment period, and related to the implementation of the Sign Language Licensure Act, ODHH did temporarily suspend the recruitment efforts that we had underway. However, the agency does consider that these positions are critical and necessary to the implementation and intend to recruit individuals by the end of the current fiscal year, 2026, with all of the positions filled at the start of our fiscal 2027 budget year. Additionally, if you look at Chapter 442 and 443 of the 2024 publications, when it came to the working group for the deaf, deafblind, and hard of hearing working group, the DDBHH community would require full staffing, and it is essential for ODHH to properly implement and support this unit. When it comes to one of the staffing positions that are currently vacant, it is important to recognize that the agency's ability to carry out this work needs to be fully staffed so that we can also support the broader statutes and statutory requirements and responsibilities of our office. For this reason, ODHH does not concur with the recommendations to abolish a vacant position. If you look now to our page 5, when it comes to the key observations, it says that DLS recommends that we adopt a committee narrative, or recommends adopting the committee narrative, rather, which has requested ODHH to submit 2 reports with updates on the development of the sign language licensure and interpreter licensure within the state. And there are regulations to that effect. ODHH does concur with that recommendation and recommended action and to providing those updates on the Sign Language Interpreter Licensing Act and the requirements. If you look at page 7, the operational budget, the recommendations and recommended actions, ODHH respectfully disagrees with the recommendation of, again, abolishing one of the vacant positions that has been vacant for more than 1 year. ODHH also does concur with the recommendation and the recommended action of providing the updates on the sign language licensure interpreter requirements. Thank you. I would like to open up to any questions that you may have for me.
Thank you, Madam Director, for your really helpful testimony and the agency's response to the DLS questions. I'm going to turn now to see if colleagues have questions, and I see Delegate Stunko.
Thank you. Madam Chair. Thank you for joining us, Madam Director. As you're aware, which is pointed out in the DLS comments and recommendations, the Sign Language Interpreters Act was originally required to be implemented by July 1st, 2024, and there's been significant delays. During the public hearings that were held, which I watched back and attended at the time, a primary complaint by the Sign Language Interpreter Board directly was that they were not getting specific or timely instructions from ODHH. That caused a lot of disclarity and challenges between the board members, interpreters, deaf, deafblind, and hard of hearing community. And I know there's been a lot of concern additionally around the subspecialties that the board is in charge of creating the policy and recommendations for. Part of my concern there, which I think and believe fundamentally was unintentional, is that some of the requirements that were laid out in the subspecialties that were recommended initially would lock out underrepresented groups from being able to break into those subspecialties. The apprenticeship model, that's an important part of the more advanced parts of sign language interpreting for the community. Additionally, part of the bill requires a licensure fee, so it's fair for the interpreters to be able to have clarity on the licensure and its impact to them. I have some concerns around recruiting, training, and in the industry when there is this disclarity for a long, ongoing part of time. So that's a long-winded way of getting to the Q4 2025 meetings that were held and the go-forward approach. I'm not aware of any of the specific outcomes of those meetings, and I may have missed those or the recommendations. Can you share the recommendations that came from, I'll use the meeting of minds, for lack of a better term, and if they did not provide them formally, when are you expecting to have them, or is your office driving that process?
Thank you for your questions and your comments, Delegate Stonko. As a response, this has been a challenge for the board. There have been some challenges that have come from, again, clarity on roles and responsibilities, which is why we did include our Assistant Attorney General to support in that area. We have finally, I am happy to say, cleared that part up. When it comes to public comments from the community, that is an additional area of challenges that we have seen. The Governor's Office established a working group to provide more community feedback, and we felt that there were we noticed that there were comments about some people not being included in regards to specific groups. Now, for that governor's working group, my understanding is that they decided to hold and suspend activities until the current legislative session is finished. So we should be able to address some of those concerns that you have, as well as the department through a departmental proposal. And again, that will share concerns with us that we can then bring to the General Assembly.
Thank you.
You're very welcome.
Madam Vice Chair.
Thank you so very much. And I want to thank Madam Director for being here. You touched upon this a little bit, but I would like to just drill down just a little bit more. And I'm going to go to page 4 regarding staffing. So you spoke to the 4 DLS pointed out, you spoke to the positions that have been vacant for over a year. Last year, there were also 4 vacant positions, and I was curious, what roles are the 3 positions excluding the contractual assistant? And have these vacancies limited the agency in any way? I just want to make sure we get all this on the record.
Absolutely, thank you. So the positions that we want to hire for are the compliance director, or rather, pardon the interpreter, compliance officer, And one moment, just to get the specific titles. Our policy manager, and, oh, okay, thank you. So we have our compliance director. Sorry, pardon the interpreter. Pardon the interpreter. That's deputy director, and then our compliance officer, and our third would be our policy manager. And right now we are operating as a small unit of 3 individuals working to prioritize things as they come with various different responsibilities that we are looking to attend to. Those 3 positions will be to support the State Board of Sign Language Interpreters and, again, the interpreter licensure. We would be utilizing those positions to support the complaints process, and that would be fairly overwhelming for the 3 that we currently only have. We also have the portal in One Stop that we are going through the process of establishing and making available. And we need to find a balance within the team to make sure that we have the ability and manpower or woman power to help out throughout all of those various areas of responsibility.
Thank you. I do have from my notes from last year, it was the deputy director, an outreach, an interpreter manager, and the compliance officer. Were the vacancies from last year from my notes. I was wondering, with the 3 vacant roles needed by the end of fiscal 26, has recruitment begun?
So I do want to let you know that we already have our outreach interpreter manager already. That person has been doing really most of the work for the State Board of Sign Language Interpreters Board. And we have been supporting them. That would be Tanea Brown. Now, we have conducted interviews, but we were told because of the hiring freeze that we need to suspend that process. They told us so that we would have to hold off on any offers, and that's essentially where we are at now in that holding pattern. Now, we did, as I said, conduct the interviews for the positions.
Thank you. So we are well past the recruitment, we're into the interviews, and we're in a holding pattern. Thank you so very much, Madam Director. I appreciate you.
Thank you, Madam Vice
Yes,
Chair.
ma'am. Thank you.
Delegate McCaskill.
Thank you, Madam Chair. Thank you, Madam Director, for being here. I'm going to focus on community engagement. So could you please describe the criteria and process of selecting members of the work group for the deaf-blind, and deaf hard of hearing?
For the working group, the criteria that were established previously, it was during the legislative session, so I believe the working group was based on how an individual qualified, meaning the person had the ability to interact and work with deaf-blind individuals. And we were also, one second. We also were looking at setting up a commission's office, and that was the origin of the bill. It was then converted to a working group for further study to determine whether or not and what would be the best practice and approach to setting up a commission's office. So that's essentially where that idea came from. And then we came up with the criteria of who would be essentially helping and bringing the numbers of stakeholders when it came to the deaf, blind, and hard of hearing communities together with other state commissions, finding out what other states have done in the past. And we've expanded that with the goal that we want to provide more services, meaning that those individuals who are deaf, they do support more services for the community, and to have a one-stop shop or one location that they can go to for all of those. So the bill was converted to establish that working group. So the criteria was based on the skills of individuals who had those skills specific for working with the deaf, blind, or hard of hearing communities.
Perfect. In thinking about selecting the members, how do you divide this responsibility between the appointments office and yourself?
So the appointments office really, we have a very strong working relationship and engagement with them. They've been very engaging in sharing with us, the applicants of those individuals. And they will often ask for advice when it comes to the individuals that have reached out and applied for the position. And oftentimes we'll work to connect all those individuals. It will depend on where they live geographically. We look at the various demographics, what skills and lenses they may bring to support the deaf community writ large. So whatever, essentially I share with them or they share with me, we make sure that we are looking at those individuals who could complement the board, and they make the final decision, and they will provide us with a list. But essentially, the final decision for the appointment to that board or working group, rather, would be from the appointments office.
Thank you. Madam Chair, if I may, one more. Yes. Thank you. Sticking to community engagement, in addition to the public comment period, how have you ensured the deaf, blind, and hard of hearing Marylanders are incorporated in the public policy process?
For public policy, we are always working with our deaf, blind, and hard of hearing organizations within the state. We keep them informed of our work. Of course, we have the Maryland Advisory Council of Deaf and Hard of Hearing, or MACDHH, and we work closely with them to that effort. We look, and again, Diamond is the reason why I turned to her and see if she wanted to comment. She's sort of my right hand when it comes to these, and working with that council as well as with other groups to maintain awareness of those. We do have a list of 14 different organizations that we interact with and keep advised of various efforts.
Thank you, that's good to hear. And lastly, can you provide any specific examples of community feedback that may have resulted in changes?
Thank you for bringing that up. Now, during my first time in the office, we had a town hall related to Lead K. And the comments that we saw from the community was really focused on families who were not signing. 90% of the families who have deaf or hard of hearing children don't sign. So for those babies that are born, they are in a language-deprived environment, and they often do not have access to language in their homes. Now, at that town hall that we had, that brought to forefront, and we were able to utilize that and allow us to bring to the legislature the Lead K bill and the impetus behind it. We have, again, when it came to Maryland Department of Health and Maryland Department of Education, we wanted to make sure there were no duplicate efforts. So we spent a lot of time looking at where the data would lead us. When it came to different hearing statuses, or deaf, blind, or hard of hearing, and the cultural aspects, when it came to sign language and versus those who did not sign, we looked at that, and I would say that was something that came about from those efforts. And the community wanted access to ASL. And they wanted access in ASL to the various aspects of life, whether it's governor's comments, what state business is happening. We wanted to be able to provide that access, or rather they wanted that access provided to them and afforded to them to know what was going on. So we were trying to figure out how to help with that. And we started to make different short videos that we were then able to then support information sharing to our constituent groups. Could inform them in synopsis of what things were going on. So if there was, so they were able to then access that information in their native language, and that was something that came about from those community feedback efforts that we undertook. Thank you.
Nice, thank you so much. Thank you, Madam Director, for all that your office, your agency does.
Thank you, Delegate. Delegate Heimbach.
Thank you, Madam Chair. Thank you for your leadership, and thanks for the services that you provide. Delegate McCaskill took a big part of my question I wanted to ask you, but I do want to follow up on it. You mentioned that you put a lot of emphasis in the past year on communications, and you talked about town halls and I think maybe social media and that sort of thing, and as an attempt to outreach and collect information from your clients. I just, I wonder, and you talked about this briefly on the previous question, but are you satisfied that that's an effective way to get information or to learn more about what the needs are of the people that use your services? And secondly, if you could just very briefly kind of recap for me, through that outreach process, what was the single biggest need that you identified?
Absolutely. The biggest need that we continue to hear is when it comes to interpreters. We're hearing various challenges when it comes to providers who are using VRI, or virtual remote interpreting services, where the technology is just not adequate for the needs. It provides challenges because the interpreters are freezing. It's unintelligible when it comes to the ability to access the information. And these are medically required situations that require interpretation, that it's on a continuous basis, that allows people to communicate across the state, regardless of where they're from. And we see those, again, barriers to communication with medical providers and others across the state of Maryland. So that is something that we see a severe lack when it comes to interpreter being provided, access, and quality. So it really, when it comes to an emergency situation, people want to have an interpreter available. And oftentimes they're left wondering, what would they be left to do? Oftentimes, people will talk to a neighbor of a deaf individual who doesn't necessarily know where the deaf person is when a problem happens. So again, in these town halls, we become aware of these day-to-day challenges that deaf people are facing with the lack of interpreters. And again, it comes back to access to the deaf individuals, as well as access from them. And sometimes when it comes to VRI, that video remote interpreting, it's not always the best solution. If there's not telecommunication available, then it's not able. First responders need to have access and the ability to utilize interpreted conversations, and VRI doesn't work in those situations. Our office has been working very diligently, and we have met with the Baltimore Police Department to make the visor cards available. And with those visor cards, this program that we have been working on, it will be launching soon in April, and we'll be providing information on communication challenges that our constituents feel that they face. Now, these are issues that have been long-standing within our field, and we are continuing to work on them.
Thank you. One quick follow-up. With the improvements in AI, do you have reason to be optimistic that part of the problem with the shortage of interpreters can be handled with in the future with maybe small handheld devices like a phone?
I do like your question because I am an advocate for technology. Diamond knows this quite well. I do love technology. So if you look at Meta Co-Design, I was actually part of their team. And we were trying to be creative when it came to those glasses and closed captioning, and then also reversing it so that if an individual is signing, it would pick up their signing and translate that into English and captions for the individual wearing the glasses. Now, AI still needs models, and using those models, unfortunately, we haven't had enough, but it will continue to learn from exposure to various ASL samples, and that's what is required until there is the possibility for true independence. Now, I do use my phone to communicate with my neighbors. We have the ability to utilize live transcribe and things of that nature. And also, if something comes up that is not quite correct, we can, I can show that to them. Technology is not readily available to us all the time. In a car accident, this would be a situation where you would not be able to necessarily have that available. Or if your car breaks down in a remote location, if you're utilizing Bluetooth, there may be issues that when you're having, to make sure that all of the systems are in place and the infrastructure is connected when it comes to your phone, to car, et cetera. So sometimes you have to get to a place where a phone is available. So I do think that AI is coming with solutions in the future. So thank you for the question.
Thank you. Thank you, Madam Chair.
Thank you so much, Delegate. Any further questions from the committee? Okay, seeing none, thank you so much, Madam Director. Thank you, Diamond.
Thank you very much.
We'll see you soon. Thank you.
Thank you. It
Thank
has been an
you.
honor.
That concludes the budget hearing for the Office of Deaf and Hard of Hearing. We will now go on to the Department of Disabilities, first beginning with our budget analyst, Connor Brown again from DLS. Welcome back to the table, and you can begin when you're ready. Thank you.
Thank you, Madam Chair. Good afternoon again. My name is Connor Brown, Policy Analyst with the Department of Legislative Services, here to present the fiscal 2027 budget analysis for the Department of Disabilities. To begin, on page 1 of the analysis, the fiscal 2027 budget for MDOD decreases by $540,663, or 3.4%, to $15.6 million. On page 2, there was a federal rescission of the Social Security Administration's Interventional Cooperative Agreement Program, or ICAP funding, which is the primary driver of this decline. Although the award was canceled and no funds were spent in fiscal 2026 before the cancellation, almost $900,000 of funding from this program is included in the fiscal 2026 working appropriation. Also on page 2, MDOT has 2 proposed fiscal 2026 deficiencies. The first is for around $180,000 for personnel expenses, and the second is to withdraw $450,000 from the Telecommunications Assistance Maryland, or TAM program. That is due to the Senior Call Check program being double budgeted in fiscal 2026 in both MDOT and the Department of Aging. This deficiency ensures the program is only budgeted once in the Department of Aging. Moving on to page 3, Exhibit 1 shows an overview of agency spending in fiscal 2027. Approximately 37% of the budget supports personnel, the majority of which is within the Office for Individuals with Disabilities. Combined expenses in the TAM program account for 30% of the budget, funding programs like Maryland Relay and the Maryland Accessible Telecommunications Program. Pages 4 and 5, Exhibit 2 outlines line item changes in the fiscal 2027 allowance compared to fiscal 2026. Other than the ICAP grant, notable changes include the addition of 3 contractual positions in the fiscal 2027 allowance, which are discussed on page 6 in the personnel section. These contractual positions will support MDOT's participation in the Department of Service and Civic Innovation's Service Year Option Program, as well as the new Office for Disability Employment Advancement and Policy, which I will discuss later. At the bottom of page 6, the Key Observations section begins with the Universal Services Trust Fund, or USTF, which is a special fund that supports TAM program expenses. Revenue comes from a fee on telecommunication service bills. Descriptions for the various TAM programs can be found on page 7. On page 8, Exhibit 3 breaks down program expenditures by fiscal year. In fiscal 2025, Maryland Relay, which provides telecommunications relay services for Marylanders who have difficulty using a standard phone, accounted for 58% of all TAM program expenses. On page 9, fiscal 2026 saw an adjustment in the surcharge funding the USTF. Despite a steady growth in expenditures, revenues were not keeping up. In order to maintain program sustainability, the surcharge was raised from 5 cents per month to 9 cents per month, effective July 1st of 2025. On page 10, Exhibit 4 shows MDOT's estimated revenues and expenditures for the USTF with this new surcharge. In fiscal 2026, the surcharge is projected to raise $5.4 million, slightly exceeding expenditures each year through fiscal 2029, though by a shrinking amount. At the bottom of page 10 is a discussion on the new Office for Disability Employment, Advancement, and Policy, which was established by Chapter 1 of 2025. The fiscal 2027 allowance for this office is $250,000. To prepare for the new office, MDOT has engaged in policy evaluations and listening sessions for implementing Chapter 1. MDOT should comment on preliminary findings from fiscal 2026 policy evaluations and listening sessions. On page 11, a new departmental bill would require MDOT to oversee and administer affordable and accessible housing programs. Additionally, it would require MDOT to establish one or more affiliated foundations to solicit contributions. MDOT should comment on how it would integrate new housing programs and foundations into its existing work, as well as any potential overlaps, challenges, or additional resources needed for implementation. Additionally, MDOT should comment on any potential operational or budgetary impacts of such a program. Finally, on page 12, the Department of Legislative Services concurs with the Governor's fiscal 2027 allowance. With that, I conclude my presentation, and I'm happy to answer any questions you might have.
Thank you, Mr. Brown. Any questions for our analyst? Okay, seeing none, thank you so much. We'll now invite to the table Secretary Beatty and team. You may bring whoever you wish, Madam Secretary. Just please have them introduce themselves to us for the hearing record today. And once you're seated, you can begin as soon as you're ready. Thank you. Welcome.
Good afternoon, Chair Shetty, Vice Chair Jones, and the entire subcommittee. Would you like me to move this up? Oh, okay. I'm Carol Beatty. I'm the Secretary for the Maryland Department of Disabilities, and with me at the table is our Deputy Secretary, Ann Blackfield, and our Assistant Secretary, John Brennan. Also in the audience today, we have Jade Gingrich, who is the Executive Director of the new Office for Disability Employment Advancement and Policy, and also David Bahar, who is the Executive Director of the Telecommunications Access Maryland. And then to round this out, we have the Executive Director of the Developmental Disabilities Council, Rachel London. And we want to thank our assigned DLS analyst, Mr. Connor Brown, for his very thorough analysis. And you have our written testimony. So with your permission, I would like to discuss the issues raised by the analyst. We were asked to comment on the preliminary findings from FY26 policy evaluations and listening sessions for the Office of Disability Employment Advancement and Policy, which we're calling ODEP, and the Maryland as a Model Employer Initiative. The office was created last year by the General Assembly through the Governor's Model Employer Act. And we began our work in late fall of 2025 with the department being created, and then we also created a multi-agency work group that has been meeting monthly to create an implementation plan. This group has met regularly to identify state hiring capacity and challenges related to disability employment, and to create a plan for state agency training needs, refinement of state hiring processes, assistive technology as a response to reasonable accommodation requests, and successful recruitment strategies. Our director of the new office has had multiple meetings with interested members of the disability community to solicit feedback and recommendations, and the interagency work group is planning and will be hosting a disability listening session this spring prior to submitting its final recommended plan in June of 2026. We were also asked to comment on how our department will integrate the new housing programs and foundations into its existing programs, as well as potential overlaps, challenges, or additional resources needed for the implementation and any potential operational or budgetary impacts of such a plan, of a program. So if passed this year and signed into law, SB 22, House Bill 226 will do two things. First, the bill seeks to establish the department's current housing work in our statute. This is really a technical, it's technical in nature, this particular part of it. Second, it will allow the Department of Disabilities to establish one or more affiliated foundations, and these foundations will be designed to support our programs in housing, assistive technology, and employment. This bill was modeled on the structure of House Bill 17 for the Department of Natural Resources, which passed last legislative session, and we thank our colleagues and DNR for assisting us with this particular bill. MDOD will use existing staff for the initial setup, and we fully expect the foundation to become self-sufficient and self-sustaining and operated by a board of volunteers. Beyond our budget analysis, I also want to take this opportunity to inform the subcommittee about a very recent federal funding change action that impacts our FY26 and FY27 proposed budget. The Centers for Medicare and Medicaid, CMS, informed the Maryland Department of Health recently that funding for the long-standing peer outreach and support program would no longer be available. This program has been funded through the Money Follows the Person demonstration grant since 2011 by MDH through a cooperative agreement with MDOD to allow for disabled peers to visit people in nursing homes who are eligible to receive services in their community. MDOD has historically contracted with the statewide network of Centers for Independent Living to perform this work. The CILs were notified by MDH and MDOD last week with a contract end date of March 23rd, 2026. This federal action will have a significant impact on MDOD, on our budget, and on these community nonprofits and their employees with disabilities. This action will eliminate approximately $200,000 in funding for the contractors for the remainder of FY26 and $705,000 in ongoing annual revenue for FY27. This represents 19 staff positions, including 13 peers, 5 support staff, and 1 contractor for the Eastern Shore. It also creates a budget deficiency for MDOD of approximately $24,000 in FY26 and $92,000 in FY27, which was included in the governor's budget allowance. This represents 30% of one of our positions and 25% of another. We are currently working internally with DBM and MDH to address this issue and to find any potential solutions for FY26 and FY27. Finally, I respectfully support the recommendation to concur with the governor's allowance, and this concludes my verbal testimony, and we would be happy to answer any questions you may have.
Thank you, Madam Secretary. Do any of your team members have testimony they're offering as well, or are they there to support with questions? Or both?
There to support with They're here to support with questions.
You all are
Oh,
here
I'm
to
sorry.
support with questions. Okay, great, thank you. Do I have any members of the committee with any questions? I have trouble seeing microphones, so, Madam Vice Chair?
Thank you so much. Thank you so much, Secretary. I got lost in my notes because we have a lot today, let's just be honest. I wanted to talk about some of the vacancies. On December 31st, MDOD reported 3 vacancy positions, with 2 positions vacant for less than 6 months and 1 position vacant between 6 to 9 months. Can you describe what recruiting efforts, hiring efforts, and other efforts MDOD has taken to address the issue of filling these vacant positions, please?
Yeah, thank you for the question. I'm going to turn it over to Assistant Secretary Brennan.
Yes, thanks for the question. 2 of those positions are within MDOD. The other vacant position is with the Developmental Disabilities Council. The executive director is here today, so I won't speak on her behalf, but related to the 2, which are the ones that are been vacant for less than 6 months, we currently have active recruitments going on for both of those. We're in the interview stage for one of them. We expect that to be filled by the end of February. The other one is a internal recruitment, which is also active, that we expect to be filled by early March.
The department is requesting 3 additional contractual positions. Let's provide some greater detail on why these positions are necessary and how they will support the mission of the department, please.
Those positions are for the ODEEP.
One is for ODEEP, which was part of the allowance that we were given when the legislation was passed, and that is to hire a job coach who is going to help with the effort, and as well as providing technical assistance on reasonable accommodations. The other 2 are related to our participation in the governor's Year of Service initiative through the Department of Service and Community Innovation. We hosted 2 members this year that serve as IT accessibility specialists, and they work on ensuring that our digital information technology is delivered in an accessible format. We are both a partner and a host and operating partner for the program, so we also we helped create the program. It's called the IT Accessibility Corps, and recruited 6 other state agencies to host members that are focused on IT accessibility, which is helping agencies comply with Section 508, as well as the upcoming ADA Title II requirements that they're mandating coming this April. So those positions support that effort, as well as our participation in the governor's initiative.
Thank you so much, Madam Chair.
Thank you, Madam Vice Chair. I can't tell if you guys have your mics lit. I'm sorry. Oh, I see Delegate Heimbach. Go ahead.
Thank you, Madam Chair. Thanks for being here. Thanks for your response to the DLS analysis. I have this question may be a little premature, but I think it's beginning in October this year, you're going to start managing, I think, affordable housing, if I read this right. I'm just curious, and it requires you to create at least one foundation that could accept public and private contributions. I know it's early, but have you done any research, or do you have any indication of what kind of interest there might be out there in terms of private contributions?
That's a really great question. Thank you for it. I do want to also...
Thank you.
I want to reiterate that we are currently, and have been for years, involved in working with partners at MDH and also with DHCD to really work towards increasing affordable, accessible housing for people with disabilities. That work was not actually in our statute, and so this year we are putting it into our statute if the bill passes. So that, but you're right that we also are looking at establishing a foundation so that any money raised or grants that that are out there that are available could be directed towards improving and increasing that work. I'm going to turn it over, the rest of the question over to our Deputy Secretary because she actually worked on this bill along with her colleagues at DHR, or DNR. So, Ann?
Is my mic
Yeah,
on?
it's
Do I have
on.
to turn- okay. Yeah, thanks for the question. We haven't identified specific funders. Really, the idea is that we're setting up this affiliated foundation, which, as the Secretary mentioned, will be run, it is going to be independent from the department. It'll be run by a board of volunteers. And that's really what we're hoping that they will do, is start helping find possibilities for private money or grants that are available to nonprofits but aren't available to government agencies. The department in the past has been able to find grants and private public partnerships, but not everything's available to government programs necessarily. Sometimes private funders want to work with another nonprofit. So that was partially what motivated our decision to propose create an affiliated foundation. So as of yet, we don't have any specific relationships or anything right now specific to this affiliated foundation. We're sort of taking it one step at a time.
Thank you. Thank you, Madam Chair.
Thank you, Delegate. I want to ask a question that's kind of related. Can you share a little bit about what your thoughts might be on the long-term effects, if any, on efforts of the public-private partnership in light of increasing pressures of affordability in our state?
Affordability specific to, I might actually.
To all the things, but I guess for this question, we'll talk about housing.
And it might actually then defer to Assistant Secretary Brennan. He's really the expert in our housing work so far.
Sure. So as it relates to housing, as it's been said before, we've been involved in this space since 2010, 11. We operate a wait list for, it's called the 811 program, which is a specific source of housing for people with disabilities, specifically who are trying to transition out of nursing facilities and into the community. That is really our sole source of funding, to be able to provide housing for that specific group within the disability population right now. We had one public-private partnership with Weinberg that lasted for several years, which allowed us to increase the amount of units that we were able to put into existing DHCD LIHTC, low-income housing tax credit program units. They now are focused on permanent supportive housing, which is different than the type that we're trying to provide, and so that dried up. We have a wait list of roughly around 2,000 people, and through our housing programs, we've created about 300 units, and these are units that would be affordable to someone who relies solely on SSI level income, so we're talking the most extreme low-income people in our state. So the affordability issue is huge. We have more people than can meet the need. Through the example that was provided with our partnership with Weinberg, we'd like to try to see if this affiliated foundation idea allows us to attract more funding to help with that affordability issue, especially when it's a requirement that the funds must be given to a nonprofit.
Great, thank you. Delegate McCaskill.
Thank you, Madam Chair. I wanted to refer to Appendix 1 on page 13. I'll give you a second. All right. I'm going to concentrate on contractual line 2 and contractual line 8. Position 2, the contractual positions increased by almost 43% between FY 26 and 27. Could you elaborate on the increase of contractual positions?
The increase in contractual positions is what we said before. It's those 3 positions that we outlined, the 1 for the new office and then the 2 for to participate in the IT Accessibility Core program in coordination with DSCI.
You did say. Okay, perfect. So can you help me understand how in line 8, I'm looking at the deficiency of 802,363. What are the specific reductions in the contractual services there?
The contractual services change, well, first, it's not connected to the contractual employees.
Position, okay.
They're separate. So what that is a decrease in the projected contractual costs that we have across the entire MDOD budget for FY '27. I can get the specific breakdown to you and provide it to you shortly after the meeting if you'd like. I don't have it here in front of me, but that's
Perfect.
roughly what it represents, is a decrease in projected expenses that we would have related to contracts we put in place with vendors.
Oh, perfect. Well, I see contractual, it just all went together
Yeah, it's
for my mind.
confusing.
That's why I just wanted you to expound. Thank you, Madam Chair.
Thank you. Seeing no further questions from the subcommittee, thank you so much for being here today. We really appreciate the work that you do to support Marylanders with disabilities.
Thank you.
Thank you. That concludes the budget hearing for the Department of Disabilities. We will now continue on to, again, this is a change to the original published agenda. We're going to do the Maryland Department of Health Public Health Administration, starting with our DLS analyst, Naomi Kimura. Thank you. And Ms. Kimura, you can begin when you're ready. Thank you. Oh, and thank you to the interpreters who were here for our first two budgets. We really appreciate you. Thank you. Thank you.
Good afternoon. My name is Naomi Kimura. I'm the budget analyst with DLS, and I'm going to present the fiscal '27 budget for the Public Health Administration in MDH. So the budget for this agency decreases in fiscal '27 by about 13.4% to $276.3 million. On page 2, we've summarized some of the funding that was thought to be at risk by recent federal changes, but note that PHA did not lose any federal grants through this process due to litigation that has been resolved. There's a couple of proposed deficiencies in the fiscal '27 budget plan for fiscal '26. Both of these are negative, and so they result in $1.1 million in savings in federal funds in PHA. The pie chart on page 3 shows the purpose of funding in the fiscal '27 budget in PHA. A majority of that is allocated, the largest portion of it, rather, is allocated to local health departments through grant funding. This includes a formula funding as well as funding for prior year COLAs for any state staff that work at local health departments. On pages 4 and 5, we've summarized the major changes in the budget between the current fiscal year and fiscal 2027. The main driver of the decrease in fiscal '27 is the end of one-time funding for COVID-19 related expenses that were paid for with general funds in fiscal '26 because they ended up not being reimbursable by FEMA. That decrease is partially offset by smaller increases, including due to salaries. There are 14 positions that were transferred into PHA from other areas of MDH. Majority of those 13 were a part of the Department of Health internship program, which is supported with federal funds. Regarding the Budget Reconciliation and Financing Act, there is language in the '27 budget bill that includes a $2 million general fund reduction contingent on a provision in the BRFA that would authorize the transfer of excess special funds from the balance of the State Board of Physicians. This provision would also authorize a contingent special fund appropriation to replace those funds. There's an additional provision in the BRFA that would authorize the transfer of $10 million from the Maryland Loan Assistance Repayment Program for nurses and nursing support staff. However, DBM has indicated that this is actually a mistake. It is meant to be transferring funding from the Nurse Support Program, which is in the Maryland Higher Education Commission. And so the Department of Budget and Management will submit a BRFA amendment to fix this. The next section is related to personnel. So there's 14 additional regular personnel in the fiscal '27 budget plan. As I mentioned earlier, 13 of these are coming over from FIPA as a part of the Maryland Department of Health internship program, supported with a federal fund grant. I'll also note the vacancy rate as of December 31st, 2025 was 15.34%, which equates to 82.5 vacant positions, about 31 higher than the amount needed to meet the budgeted turnover. This does not include actually positions that were abolished as a part of the voluntary separation program. 12 positions in fiscal 26 were that were abolished were vacant, and the other 9 were through the VSP. I'm going to next move on to the key observations in the report. The first has to do with the Commission on Public Health, which I know you had a briefing on recently. So this section summarizes the work of the Commission. They were tasked with analyzing the state's public health system and making recommendations to improve the foundational public health services of the state. Exhibit 3 on page 9 summarizes what those are. This is a model taken from the Public Health Accreditation Board, which includes public health areas and public health capabilities that are deemed foundational for a public health system. Maryland added behavioral health as one of the foundational public health areas. We've also summarized the recommendations that the Commission made by groups. So there's 5 of them listed on page 10. They have to do with strengthening public health infrastructure, modernizing communication, data, and IT systems, leveraging and formalizing partnerships, and then increasing public health education and improving primary care access throughout the state, and then finally improving and expanding the public health workforce. Finally, we've described some of the efforts that the Department of Health has taken that align with these recommendations, but really the Commission's work is ongoing through June of 2026 to try and advance some of the recommendations. And we've also noted that MDH has indicated that there is potential opportunity to leverage certain federal fund sources to advance some of these goals. The second section relates to local health department funding. So there was language in the budget bill last year that restricted funds pending the Department of Budget and Management to budget formula funding separately from salary-related funding at local health departments. So as I said before, some health departments employ a mix of local and state employees, and so they receive money from the state to cover some of those salary adjustments that apply to state employees. DBM did this. They followed the budget language, and so DLS is recommending the release of the restricted funds and will process a letter to this effect if there are no objections raised by the subcommittees. The fiscal 27 budget includes, like I just said, the formula funding and the salary-related funding budgeted separately. The exhibit on page 13 shows the allocation of the formula funding by jurisdiction. So DBM has indicated that it started with a base of $80 million in fiscal 27 and grew the formula by $3.1 million. However, the budget is level funded between fiscal 27 and fiscal 26. And so in order to make up for the increase, it must have been offset by a decrease in prior year COLA funding. Before accounting for the fiscal 27 COLAs, which are budgeted in DBM and will be added into this local health department budget later, it does appear that smaller counties have a decrease in the amount of funding that they're getting. Once those fiscal 27 COLAs are added in, that should be rectified. But this is something that we bring up in the analysis, and so we've asked MDH to update the committees on the amount of funding that LHDs can expect to receive for fiscal 27 COLAs, how they will be allocated, and when they will be notified of this allocation. We've also asked DBM to clarify when these COLAs will be realigned into the CPHS budget. So typically, the counties that are the largest tend to have a higher ratio of local employees to state employees. And so therefore, they would receive either literal or no funding related to salary adjustments and COLAs. However, with the fiscal 27 budget, the 5 largest counties and jurisdictions that have the fewest number of state employees actually received the largest increase. And we have asked MDH and DBM to comment on why there is no salary funding budgeted in that separate program for Anne Arundel, Baltimore, Montgomery, and Prince George's County in fiscal 2027, despite having at least one state staff member. The final part of this discussion relates to the local match requirement. Local governments are required to match a certain percentage of the funding they receive for local health departments. And when the appropriation for CPHS grows significantly, that means that the match burden is also quite high. And so the Department of Health indicated last year that it would amend the match regulations to alleviate some of this. There was language restricting funding pending submission of those regulations. They submitted the regulations in January, and they also submitted a report summarizing the changes to the new regulations. So DLS is recommending the release of these funds as well, and will process a letter if there's no objections raised by the subcommittee. With that, DLS recommends concurring with the governor's allowance, and I can take any questions if you have any.
Thank you so much, Ms. Komoro. Any questions from committee members? Great. Thank you so much. We will now call up our agency friends, Dr. Sullivan, Assistant Secretary of Population Health and Strategic Initiatives. I see Madam Secretary is here as well. Good afternoon. And anyone else you wish to bring down is welcome as well. Please just begin when you're ready. Thank you. And I promise this time, Madam Secretary, I won't jump out of my seat to ask a question. We'll hold until you're ready for us.
Good afternoon, Madam Chair, Madam Vice Chair, and the committee. Thank you for having us here. For the record, I'm Dr. Mina Seshmani, Secretary of Health for Maryland. You all have heard enough from me maybe during our budget overview. So I will just quickly thank our DLS analyst for her work on public health administration, and just say that, as you all know, maintenance and improvements in our public health system are really critical to us being able to protect and advance the health of all Marylanders. And this has been an area of focus for us. And I will turn it to my Deputy Secretary for Public Health, Meg Sullivan, and David Davis to go into further details.
Great. Thank you so much, Secretary. And good afternoon, Chair Shetty and members of the subcommittee. My name is Dr. Meg Sullivan. I'm currently serving as the Deputy Secretary for Public Health Services at the Maryland Department of Health. And just want to start off by thanking the Governor, the Department of Budget and Management, and the Budget Committee for their support. We also thank the Department of Legislative Services for its insightful budget analysis of the Public Health Administration, and echo the thanks for our budget analyst. We also do want to acknowledge the recent report and recommendations published by the Commission on Public Health that was referenced in the analysis to continue advancing public health priorities across the state. And the department looks forward to continuing the work of the commission members and affiliated coalitions such as the Maryland Association of County Health Officers, or MACHO, and the Maryland Association of Counties, or MACO, to advance the recommendations and protect the well-being of our communities. I'm pleased to be joined today by Secretary Seshmani and members of the Public Health Service leadership team, and we are excited to answer questions and engage on matters concerning the Public Health Services Administration. I first just want to say that we are grateful that the governor's budget will help us deliver on our priorities and commitments in some key public health service areas, including vaccines, maternal and child health, the lab administration, and the Office of Healthcare Quality. We are already looking forward to future budget hearings where we can further discuss the Prevention and Health Promotion Administration and the investments that are playing a critical role in ensuring our adequate and safe supply of facilities and services for Maryland aging populations and the Office of Healthcare Quality. But today, we will focus on the programs within the Public Health Administration. We have submitted our written testimony responses for the record, which I will just spend a couple of minutes briefly reviewing, as they're only a small number. So first, for the two items where DLS has read and approved the reports that were referenced and recommended the release of funds, we concur with these recommendations and thank DLS for their support. We were also asked to update the committees on the amounts that will be allocated to local health departments to fund COLAs in fiscal year 26 and 27, including how the funds will be allocated by the county and when the LHDs will be notified of their allocation. So we can report today that for fiscal year 2026, $3,657,975 were allocated to LHDs to fund COLAs and increments. And the LHD officer, the local health officers, were provided this information on February 5th, 2026. The allocations will be dispersed to the local health departments in February 2026. Funding for the fiscal year 27 COLAs and increments will be added to the counties based on their number of employed state personnel. The total amount in allocation has not yet been confirmed by DBN at this time. And then finally, we were asked to comment on why there is no salary funded budgeted for the 4 jurisdictions for which the local health officer serves as the sole state employee in fiscal year 27. And we can explain or responded that LHD funding in fiscal year 27 was rebased to comply with the core funding formula requirement and a new stipulation that requires core funding formula and salary adjustments to be budgeted separately. So once the fiscal year 27 COLA is allocated, all counties with state staff will receive additional salary funding based on their number of personnel. And with that, we look forward to any questions you may have.
Thank you, team. We appreciate it. Any questions from members of the subcommittee? I see Madam Vice Chair is ready to hit her button. Go ahead.
Thank you so much, Madam Chair. Thank you all so much. I'm so thankful for you. If I could just take a moment, please.
Yeah.
I am so thankful to be in Maryland during these times, and I am so thankful to you and your team as a mother and just as a citizen. So I today and throughout these budget hearings appear to be a little bit of a broken record, but that's okay. On page 6, DLS analysis, I'd like to talk about personnel data. It indicates 14 positions being added to MPH. However, the analysis notes positions are being transferred from other areas of MDH. So these aren't new positions or requests, are they?
Correct.
Thank you. And can you please describe how these transferred positions will support MPH's mission and the work that you do?
Yeah, so I think in particular, we talked about some of these positions being funded by the Public Health Infrastructure Grant as interns. These are a variety of positions that support, I think you know that the mission of public health services is incredibly broad, and so they work on special projects or furthering individual initiatives or work that furthers, again, either the mission of the department or legislative initiatives that we work on throughout the year.
Okay, and then the table notes 82.5 positions are vacant as of December 31st, 2025. Can you describe what recruiting efforts, hiring efforts, or other efforts MDH has taken to address this issue to fill the vacancies?
Yeah, I'm happy to talk about that. I think the vacancy rate is something that we look at very closely. We know that we had several new PINs that were created in FY25 and have been working through that process. We know that many of these PINs, I believe that it is over half are federally funded PINs, and again, have been working on how we can successfully recruit them. Of course, the hiring freeze is complicated measures, and so we are first looking at what our mission critical activities are. Mm-hmm. We're obviously watching what is happening on the federal level very closely as we make these decisions as well, but are committed to doing what we can.
Well, I'm happy to hear you repeat that mission critical line that we all heard very loud and clear in the December 2020, just the December Spending Affordability Committee. So thank you so very much. I appreciate it, Sharon.
Thank you, Madam Vice Chair. Questions from other subcommittee members? Okay, I'm going to ask a little bit about the federal rescissions, please. So I want to talk a little bit about some of the uncertainty that we're living under, and just want to speak to, I know MDH writ large has had a lot of uncertainty because of federal money we were anticipating in FY '26, and then things shifting and changing. Can you talk a little bit about some more specifics about the grants that were at risk or are at risk for cancellation, please?
Yeah, obviously that is something that has been very challenging and top of mind. I think over the last year, there have been many grants that have either been talked about being rescinded or paused, or actually paused and then restarted again due to litigation or kind of a retraction of walking back. You know, just a few weeks ago, we had our public health infrastructure grant temporarily paused, only to have it be released. But there's, you know, the amount of work that goes in and confusion that it causes, even if it's for a short amount of time, is very challenging. I think this is, you know, while, and as the budget implies, we did not have significant funding that was ultimately rescinded, it again caused for a very challenging year, both at the state level and for our local health departments as well, many of whom receive funding either from us or directly through the federal funds. I think going forward, this is something that we are watching incredibly closely. We are constantly doing contingency planning, again, focused on what are our mission critical activities, where is our key staffing, what would be impacted, with an absolute desire to not impact services on the ground. But the reality is we don't know what is going to happen, and look forward to working with everyone, including you all, in case of future rescissions or changes in funding.
Thank you, that's really helpful. I want to focus in specifically, if I may, on some funding for the prevention and treatment of substance abuse. So I know that that was under a preliminary injunction, but then where you were able to continue some of the work after May of 2025. Has there been any other changes specifically in those funds since the restoration of those grants?
So I think, you know, some of that funding comes to us, right, and then some goes to our Behavioral Health Administration more broadly. There was recently, again, a pause in funding through SAMHSA that would have impacted our work, and something that we looked at that was restored as well. So at least at this moment, there has not been changes, but again, it's something that we're watching closely and
kind of
worried about.
broader, speaking to the uncertainty.
Correct.
Got it. Okay.
And if I may,
Yes.
to the point that you make about the broader uncertainty, we as a department are also looking where we can strengthen our partnerships with doing more public-private partnerships, working with the business community, working with philanthropy, because again, I think we've all seen the uncertainty that has been created with the current federal landscape, and making sure that we are finding those aligned goals with other organizations as well, so that we can continue the work that we need to do.
That's great. Thank you. Unfortunate that we have to do that, but great. Okay, I see no further questions from subcommittee members, so thank you, team. We appreciate the work that you're doing, and we'll continue our conversation, I'm sure. Thank you. We now have Madam Secretary and team, as is tradition in our subcommittee, I'm going to ask, if you don't mind, we do have 2 witnesses signed up to testify. Can you please just stay in the room and hear them before having to leave? We want to make sure that you're able to hear their feedback too. Thank you. So we'll call upon our 2 signed up witnesses, Jenny Reese with AFSCME Local 539 and Anissa Pierce-Sessoms with AFSCME Local 1081. And those are the 2 witnesses I have signed up. You each have 2 minutes. When you are ready, we'll begin the timer. Our amazing counsel, Mr. Gutberlet, will be doing the timing, and if you hear the buzzer, I might ask you to just come to the, go ahead and wrap up your testimony at that point. So thank you for joining us. We appreciate it.
Thank you so much, and good afternoon, Chair Shetty, Vice Chair Jones, and members of the committee. My name is Anissa Pierce-Sessoms. I serve as Executive Vice President with AFSCME Maryland Council 3. I recently retired from Worcester County Health Department, where I had 15 years of service. Our local health departments and our public employees provide a variety of public health services in our community, including behavioral health services, vaccinations in our community, nursing services, medical transportation services for clients that need to get to health appointments, and much more. However, recent funding cuts have impacted work we provide to our communities. For example, a tri-county program called Center for Clean Start was for mothers who had substance abuse problems and provided critical support for these individuals. For more than a decade, our local health department operated this program and served residents in 3 counties, Worcester, Wycomico, and Somerset. Due to funding cuts, this service was removed from our local health department and now is operated by a private entity. The child services that were provided by our local health department to the mothers who were participating in this program ended because we didn't have the staff to continue the program. Ultimately, the program was taken away from our local health department and sent to the private operator. Case management services that address basic needs with support in life services were also cut last year and transitioned to a private operator. These are just 2 examples of problematic services that were cut from our local health department due to funding issues with the local health department. Regarding the Commission on Public Health report, challenges with recruiting and retaining staff were identified. We are losing people because we're not offering competitive compensation. We agree with the Commission that we must increase the compensation in order to attract more people to local health departments and continue to deliver critical public services to our residents. We are asking this committee to support increased compensation in order to retain our veteran employees, recruit new employees into state service.
Thank you.
Please do not balance the budget Please do not balance this budget on the backs of our dedicated state employees. I thank you so much.
Thank you. Thank you so much for your testimony. Next. You need to turn on your microphone, please.
Chair Shetty, Vice Chair Jones, and the committee. My name is Jenny Reese. I am a licensed practical nurse at Springfield Hospital Center and the proud local president of Local 539. I sit before you today to bring to your attention issues impacting state employees who work at the Office of the Chief Medical Examiner and highlight why competitive compensation is needed for our state employees in the Maryland Department of Health. The work done at OCME is incredibly important and significantly challenging. We represent autopsy assistants who receive the deceased. They assist in the autopsy procedure from open to closing, and they provide support to grieving families who have unfortunately had to come to identify the remains of their loved ones. Their starting salary is just over $40,000. It's disappointing and upsetting to hear that our members have to rely on overtime opportunities in order to simply pay their bills. And they're doing their jobs to the best of their ability with the resources they have. They desperately need better autopsy instruments. They're currently using kitchen knives. We need better tables for autopsies. Recently, a tray table had fell during a procedure. We want to make sure that state employees are safe while doing their jobs. This also includes having adequate transportation for our forensic investigators who are going out at all hours of the day in the snow like we just had, and we need to make sure that they can get to and from crime scenes safely. They're collecting forensic evidence to help determine time and cause of death, they make about $10,000 to $15,000 less than other states. Our challenges must be addressed by compensating our employees with competitive wages that reflect the value of their work. The fiscal year 27 budget has proposed a COLA that does not keep up with inflation, and it fails to provide a step increase to state employees. We are asking this committee to support our request for a 2% COLA and a step increase in order to retain our veteran employees and recruit new employees into state service. Thank you very much.
Thank you. We really appreciate the testimony you all have both shared. It's always really important for us to hear from folks that are doing the work to share what's happening on the ground. So we very much appreciate you taking time out of your very busy schedules to do that. Do any members of the committee have questions for our panelists? Okay, seeing none at this time, thank you so much. We really appreciate you both. That concludes the budget hearing for MDH Public Health Administration. We will now go on to our fourth and final budget for today, DHS overview, and we will start with our DLS analyst, Suveksha Bujel, but I also see Ms. Zimmerman is here today too, so we will enjoy hearing from you both. Thank you so much. You can begin when you're ready.
Thank you, Madam Chair. For the record, I'm Suveksha Bujel, and for the Department of Human Services, I cover the Social Services Administration and the Office of Home Energy Program.
I'm Tanya Zimmerman. I'm here today as the analyst for the Family Investment Administration.
Okay. Starting on page 2, we have the funding by source for the Department of Human Services. The allowance for DHS in fiscal 27 is approximately $3.9 billion, which is a decrease of 4.1% from fiscal 26 working appropriation. On page 3, we have the functional breakdown of the spending. 51% of the total budget, or about $2 billion, is allocated for public assistance. The second largest portion is for personnel, which is about 17% of the budget, or $684.7 million. Foster care maintenance payment accounts for 11% of the budget, or $435.6 million. On pages 4 and 5, we have the budget overview for all fund types. For family investment, excluding supplemental nutrition assistance program and Sunbucks, the fiscal 26 allowance totals about $710 million, which is a decrease of $94 million or 12.3% compared to fiscal 26. The largest decrease is associated with the supplemental SNAP benefit, totaling $62 million. Fiscal 26 included $62 million to support SNAP benefits during the federal government shutdown. The Office of Home Energy Programs allowance includes $300 million in fiscal 27. Social Services Administration's allowance is about $842 million, a 3.2% increase from fiscal 26. Child support is budgeted at $136 million, a 21.4% increase compared to fiscal 26. For DHS administration, fiscal 27 allowance totals $227 million, which is a decrease of $125.3 million or 38.3%. Total allowance for fiscal 27 for DHS, excluding SNAP and the Sunbucks, totals $2.2 billion, which is a decrease of $170 million or 7.7% from the current working appropriation. Moving on to page 5, there is a breakdown by fund type. In fiscal 27, general fund totals about $1 billion, special fund totals $253.7 million, federal fund excluding SNAP and Sunbuck total $922.2 million, and reimbursable fund total $0.8 million. Federal SNAP benefit in fiscal 27 remains unchanged at $1.7 billion. Federal Sunbucks increases by $1.6 million, totaling $74 million. Moving on to page 6 is the budget overview for general fund. For family investment, general fund totals $315 million, which is a decrease of $2.5 million or 0.8%. For Office of Home Energy Programs, fiscal 27 includes $46,000 in general funds. For Social Services Administration, general fund totals $573.9 million, increase of $14 million or 2.5%. For child support, general fund totals $24.2 million, which is an increase of $3.9 million or 19%. For DHS administration, general fund totals 125.8 million, which is a decrease of 25 million or 16.6%. Total general funds for DHS is about 1 billion, which is a decrease of 9.6 million from the working appropriation. On pages 7 and 8, we have the deficiency appropriation for fiscal 26. The fiscal 27 budget includes deficiency appropriation totaling 80.2 million across THS, which includes 40.5 million in general funds. Of these, 32.3 million is for Family Investment Administration, which includes 28 million in general funds for penalties in federal fiscal 23 and 24 SNAP payment error rate. Proposed deficiency appropriation totaling 30.2 million are provided for the Social Services Administration for foster care maintenance payments. 10.2 million is provided for DHS administration, including 6.8 million for department-wide call center expenditure, and 3.4 million for expenses associated with a change in electronic benefit transfer and system modernization. Starting on page 9 is the proposed budget change chart. As mentioned earlier, the fiscal 27 budget for DHS totals 3.9 billion, which is a decrease of 168.7 million or 4.1% from the working appropriation. In personnel expenses, employee and retiree health insurance increases by 29.6 million. Salary and associated fringe benefits increased by 17 million. In child support administration, cooperative reimbursement agreements increased by 17.4 million. Foster care maintenance payments after accounting for contingent reductions increased by 7.7 million. In the Office of Home Energy Program, the Strategic Energy Investment Fund revenue allocated for energy assistance increases by 10 million. There is a 10.1 million decrease associated with the emergency funding that was provided in fiscal 26 due to delays in the release of federal fiscal 26 low-income home energy assistance program funds. Moving on to page 10, in Family Investment Administration, there is an increase of 43.1 million associated with change in SNAP administrative match rate beginning in October 2026. Family Investment Administration also includes decrease of about 28 million, which is associated with one-time funds to pay the SNAP payment error rate penalties in federal fiscal 23 and 24, a decrease of 11.7 million for SNAP employment and training, a 10 million decrease associated with one-time funds for feeding organizations during the shutdown. In assistance payments, there is an increase of 4.6 million associated with temporary cash assistance and 6.6 million increase associated with temporary disability assistance program. It also includes a decrease of 62 million associated with fiscal responsibility funds provided to partially pay SNAP benefits during the shutdown. And it also includes a decrease of 7.5 million due to anticipated savings related to EBT fraud replacement after implementation of additional security features. In DHS administration, there is a decrease of 130 million associated with transfer of Maryland benefit, which was previously known as MD Think, to the Department of Information Technology. In other changes, call center contracts decreased by 12 million. On page 11, we have the caseload estimates assumed in the budget. In cash assistance, temporary cash assistance and SNAP supplemental benefit are assumed to increase slightly in fiscal 27. TCA transitional benefit and temporary disability assistance payments are assumed to increase by 8% and 7% respectively, whereas federal SNAP cases is assumed to decrease by 4%. In child care, foster care is assumed to increase by 2%, and subsidized adoption and guardianships is assumed to increase by 1%. In child support, TCA collection is assumed to increase by 10%, and non-TCA collection increases by 1%. On page 12, we have the position information. Overall, there is no change in number of positions in DHS. By administration, regular positions in Social Services Administration, Family Investment Administration, and the Office of Home Energy Program decrease, while regular positions in DHS administration increases. There are no changes in contractual positions. In October 25, the Board of Public Works approved the abolition of 502.7 positions statewide. Of these positions, 90.3 were from DHS. 65 of these positions were part of the voluntary separation program, and the remaining 25.3 were vacant positions. Additionally, and as the Authority of Maryland Benefits was transferred to the Department of Information Technology, 18 positions were transferred as well. The table on page 13 shows filled positions in DHS by administration for fiscal 24, 25, and 26. In fiscal 26, as of December, the number of filled positions decreased by 20.7 positions. However, the percentage of filled positions increased by 1.3 percentage point. The first issue, starting on page 14, discusses the fiscal 25 closeout concerns. DHS made several errors during fiscal 24 closeout process and was unable to fully explain the causes of the errors. As a result, language in fiscal 26 budget restricted funds pending submission of closeout information by October 1, 2025. DHS submitted a report on October 17th. However, the report only included a portion of the requested information, providing only fiscal 25 expenditures for assistance payments and foster care maintenance payment. It did not provide information on the reversions and cancellations, TANF spending or balance, or special and federal fund expenditures as required. Although limited data was provided, concerns about the accuracy of fiscal 25 closeout was apparent, as neither the assistance payments nor foster care maintenance payments detailed reconciled with the information that was provided to the comptroller. Issues identified in the submitted information for assistance payments include total expenditures did not match the information reported to the comptroller. Expenditure by benefit were inconsistently reported between documents for some benefits. Most documents reported approximately $10 million higher in temporary disability assistance program total spending than the monthly data indicated. Expenditures reported for emergency assistance to families with children program are about $3 million less than what monthly reported data indicates. Some documents misreported federal fund expenditure in the EBT fraud replacements, and no document explained about more than $70 million of federal fund expenditures. For foster care maintenance payment, the total expenditures did not match the information that was reported to the comptroller, and it is unclear if the funds were used to resolve fiscal 24 shortfall of $8.1 million. DHS has delayed in responding to DLS questions, and as of this writing, most questions were unanswered. Although not submitted formally, DHS did provide additional information that was intended to be included in the report, which provided explanations on some reversions for general funds, but no explanation were provided for federal and special funds. During the fiscal 25 budget hearing, DHS had noted major challenges during closeout stemmed from lack of use of fiscal management information system to keep track of internal finances for all unit budgets. DHS had also reported that starting fiscal 25, all unit budgets had been loaded into the system, signaling that there would be a better closeout process. However, the closeout issues have persisted in fiscal 25 closeout. We are asking DHS to discuss its efforts to reconcile its fiscal 25 closeout and plans to improve its closeout process to ensure that reporting to the comptroller reflects actual expenditures. DLS will make a recommendation related to the reporting of closeout information in DHS administration. In addition to the closeout issues, DLS also received a budget amendment that was part of the closeout on December 19th. The amendment requested to increase special fund appropriation by $20.5 million and to realign $69.2 million and $192.7 million in general and federal funds, respectively. The amendment did not provide clear reasoning for the appropriations being realigned or increased. For instance, the amendment realigns general fund to increase child welfare service appropriation by $55.4 million. However, at closeout, DHS reported reverting $26.7 million from this program, indicating that nearly half of the funds transferred were not needed. The amendment also requested appropriation of $7.6 million from the Child Support Offset account. The opening fund balance for this special fund account was reported in the amendment as a negative $80 million in fiscal '25, with a closing balance after accounting for the amendment as negative $98.8 million. DHS requested funds to be appropriated from the account despite the negative starting balance. The second issue on page 16 covers the Office of Legislative Audit's review of budget closeout transactions. The report includes 4 findings for DHS, all of which were repeat findings. One finding determined that DHS could not verify whether federal funds revenue entries were accurate or properly recovered. OLA also found that DHS did not identify questionable accrued revenue entries. OLA's report included 2 findings noting unresolved deficit balances. One found that DHS had $103.6 million deficit balance in a non-budgeted fund account that may require general funds to resolve. In the second finding, OLA reported that DHS had deficit balance in certain special funds at the end of the fiscal year that may require general funds to resolve if special funds are not available or are not permitted to cover the expenditures. The last finding noted that DHS had not reported a combined $28 million potential general fund payable that resulted from federal penalties. We are asking DHS to provide an update on the status of recovery of the accrued federal funds, and DHS should also discuss its plans to address findings related to the unresolved deficit balances.
Page 17 begins the discussion of the TANF program. The funding through TANF is primarily provided through a block grant, which is largely unchanged since the program's initiation. Maryland has annually received about $228 million from the block grant. Maryland has also received TANF contingency funds each year since the Great Recession. Contingency funds are available to states meeting certain criteria related to SNAP participation or unemployment. As long as the criteria remains unchanged, Maryland would be expected to continue to be eligible to receive those funds. The TANF authorization, the last full reauthorization expired in 2010. Since that time, they've operated under a series of temporary extensions, usually, but not always concurrent with continuing resolutions. The TANF authorization has lapsed twice with each of the government shutdowns. However, because they have a balance, they're able to use that during the shutdown, so there's no impact. There's been no impact of the shutdowns. Exhibit 1 on page 18 looks at the spending of the TANF dollars by program in fiscal 26 and 27. Overall, the fiscal 27 allowance provides about $260 million of TANF expenditures, which is an increase of about $10 million compared to fiscal 2026. The largest area of increase is in the local family investment program, which is the program where caseworkers are budgeted. There's also increases of about $3.6 million in the Child Welfare Services Program, and assistance payments also receives an increase primarily due to estimated costs for TCA. Page 19 looks at the breakdown of the spending of TANF as a percent of the entire spending. In general, cash assistance in Maryland has comprise more than 40% of TANF expenditures. The fiscal 2027 allowance allocates about 43% of TANF to cash assistance. Combine the core programs of TANF, cash assistance, work opportunities, and the family investment administrative expenditures comprise about 68% of the appropriations. In recent years, child welfare-related expenses, including foster care, have comprised larger than historical shares of expenditures, peaking at about 31% in fiscal 2022, primarily due to declining availability of other fund sources supporting the programs. The fiscal 2027 allowance anticipates about 18% of the expenditures for that purpose, which would be the lowest level since fiscal 2019. However, DLS notes that the expenditures in this area are often higher than initially appropriated. Page 20 discusses some of the risks related to the TANF balance. This is a significant risk for the fiscal 2026 working appropriation and the allowance because of the expenditures that are planned to be supported with these. Based on the fiscal 2025 information reported to by DHS to the Department of Budget and Management and the budgeted amounts in fiscal 26 and 27, the closing balances would total about $11 million in fiscal 26 and $6.3 million in fiscal 2027 because the planned expenditures assume the use of some of the fund balance. However, as was discussed earlier, in both fiscal 2024 and 2025, DHS made errors in closeout, and as it relates to fiscal 25, has been unable to explain its reported expenditures. And these errors lead to significant questions about the amount of TANF used in those years and undermine the credibility of the estimated TANF balance. The net impact of the errors and incomplete reporting is uncertain and will remain so until the numbers are reconciled. In addition, the balance data presented by DHS significantly increased the fiscal 2025 starting balance compared to that which was presented in the 2025 session. It was about a $16 million increase. It's unclear how such an increase could have occurred and leads to questions about whether some expected recasting of fiscal 2024 reported expenditures as TANF, which was part of the plan to assist in resolving fiscal 2024 shortfalls, occurred as planned. It's unclear if this information is accurate or if the fiscal 2024 shortfalls were addressed. In addition, the budget includes some potentially unrealistic assumptions of lower TANF spending in fiscal 2026 and 2027 in various programs that also pose a risk to the TANF balance. For example, the Work Opportunities Program, which is solely TANF supported, had expenditures in fiscal 2025 that are about $8 million more than are budgeted in each fiscal 2026 and 2027. The Emergency Assistance for Families with Children program has about $2.4 million budgeted in fiscal 2026, or $2.7 million budgeted in fiscal 2026. Through November, they had already spent $2.4 million. In fiscal 2025, the monthly data indicated they spent about $6.7 million. So it's likely the final expenditures will be higher than the budgeted level. If the spending on these programs are near the fiscal 2025 level, and the other programs remain unchanged, the TANF balance would be negative after each fiscal 2026 and 2027. We've asked the department to comment on how it's working to reconcile their TANF expenditures for fiscal 24 and 25 to determine the availability of TANF in 26 and 27, and also how it will address any shortfalls that might occur as a result of that reconciliation. That concludes our presentation, and we're happy to take any questions.
Thank you. Appreciate you both. Delegate Ruff for a question.
Hi. The last things you talked about, the unrealistic assumptions about spending. Has DHS gotten back to you about your questions around that?
They indicated that they acknowledged that I think it was a risk, but they can probably speak more directly to what they would do.
Okay. Thank you.
Thank you, Delegate. Thank you, analysts. Any other questions for our analyst team? Thank you so much. We'll now welcome our DHS team, Secretary Lopez. Welcome back to our subcommittee. We are excited to see you and welcome you and your team. see Webster and friends are joining as well. So please begin when you're ready. We look forward to hearing from you.
Good afternoon, Honorable Madam Chair and Vice Chair, members of the subcommittee. I'm Rafael Lopez, and I serve as the Secretary of the Department of Human Services. We are grateful to our DLS analysts, Suveksha Vukjal, Connor Brown, and Tanya Zimmerman for their budget analysis. Thank you for your partnership. I also want to acknowledge members of my team joining me here at the table and also in the audience. To my left is our Chief of Staff, Webster Yee. To my right is our Chief Financial Officer, Roman Napoli, and to his right is our Deputy Chief Financial Officer, Jessica Smith. In addition, we have members of our leadership team statewide joining us in the audience, including Anne Arundel County Director of Social Services, Rachel McConaughey. Team DHS consists of nearly 6,000 employees across the state. Our 24 local departments of social services administer 80% of all of our activities in our nearly $4 billion budget, almost 70% of which is funded by the federal government. We serve more than 1 million Marylanders, including helping Marylanders empower them to unlock opportunities to live their best lives and to live their best lives for their families. When we began our work 3 years ago, we knew we had to rebuild trust and modernize a system that had fallen behind, and that is exactly what we have done and continue to do. Ultimately, we're building one DHS that works for Marylanders across all 24 jurisdictions, and we've intentionally reset relationships with all 24 local departments of social services and empowered them to better serve customers through clear direction, resolute support, and customer experience standards. We've rebuilt our internal teams and functions with a particular focus on our Office of Budget and Finance, which you'll hear more about momentarily. And we're continuing to rebuild our department to deliver for customers, lowering our staff vacancy rates and focusing on filling positions that improve service. When we began this work, we were among the worst departments with the highest vacancy rates in the department, and now we have one of the lowest rates in the entire state of Maryland. We're also making meaningful reforms that tackle longstanding problems. When we took office, for example, over 40 youth were staying in hotels, which was a decades-long practice in Maryland, and there was no central tracking of these stays. In November of 2025, we ended that decades-long practice. We found that out-of-home care providers' services and their rates were not directly connected to the level of care they provided. So far, our out-of-rate reforms have increased contracted child placement agency capacity, balanced 5% from 1,921 to 2,013 beds statewide, and we continue to tackle this issue, which has been stalled for over a decade. When we took office, we inherited the second highest SNAP payment error rate in the nation at 35.56%, and we've done nothing but cut that rate by more than 60% statewide, down to 13.64%. We're also prioritizing putting kinship care first because family matters. After advocating for changes to Maryland's child welfare system through the General Assembly in 2024, we launched an historic bit of work that we call Family Matters in 2025 to promote kin-first practices across the state to modernize the child welfare system. As of December 2025, the number of youth living with kin has increased by more than 330 compared to before the kinship law took effect, and the kinship placement rate has increased by 33% over that time period. In addition, the percentage of kinship caregivers who are licensed by the state has soared from 25% in December 2024 to 86% as of December 2025. These changes didn't happen overnight. They were deliberate, they were strategic, and they took time. We're also making benefits more secure and easier to access for Marylanders. Since July 2025, Marylanders have used the Maryland Benefits One application to complete more than 291,000 applications for critical benefits. Last summer, Sunbucks provided nutritious meals to more than 630,000 students. Importantly, 90% were automatically enrolled based on eligibility for another benefit program, and that was in all 24 jurisdictions across the state of Maryland. But we're not just making it easier to get benefits, we're making them more secure as well. We were the first state in the nation to replace stolen benefits, and at first using federal funding and then state funding to ensure that our customers do not unfairly suffer from global criminals. Since spring of 2023, we have replaced over $47.4 million in stolen benefits and helped over 73,000 Maryland households. We've made meaningful progress, but seriously hard work continues and will remain. We will not be satisfied until no Maryland family is worried about where their next meal will come from. And every young person in Maryland is thriving in a loving home with family by blood or by choice. As we look ahead, we remain focused on delivering the governor's vision to leave no Marylander behind. And we're looking at 3 specific focuses in this next fiscal year. 1, improving youth well-being by expanding our Family Matters approach, which I spoke to. We will continue to partner with Maryland families to prioritize kinship for youth, support kinship caregivers, and strengthen lifelong bonds. 2, we will help lead the way on providing securing benefits with the debut of chip-based electronic benefits transfer, or EBT cards technology in summer 2025. We are on track, 2026. We are on track to be the 2nd state behind California to implement EuroPay, MasterCard, and Visa, or EVM chip card and tap technology when we complete this transition to a new EBT card vendor this summer. This new technology will reduce stolen benefits from our customers. And 3rd, we will minimize the harm of federal changes to SNAP and preserve lawful access for Marylanders. The SNAP program in Maryland serves approximately 680,000 hardworking Marylanders, including 260,000 children in all 24 jurisdictions. And despite the new eligibility obstacles and restrictions put in place by the Trump administration through the passage of H.R. 1, we'll protect Marylanders' benefits by staying focused on preserving access, being human-centered, and building practical solutions and working in partnership. This FY 2027 budget proposal was assembled in partnership with many of you and others who advocate tirelessly for the Marylanders we serve. We stand ready to work with you to deliver bold investments in a fiscally responsible way to make this Maryland's decade. I will now turn over to our Chief Financial Officer, Roman Napoli, and our Deputy Chief Financial Officer, Jessica Smith, for our responses to the DLS analysis, and we'll begin with Ms. Smith, who will answer the first question.
In response to question found on page 15, improving closeout processes means improving the quality and accuracy of our financial reporting throughout the year. It also means making sure our data tells a clear story to our partners in DLS and DBM so they understand what is available and what it means. And to that end, we implemented a new process in fiscal year 2025 to reconcile the programmatic caseload data with the cost allocation results on a quarterly basis. This, along with continuing efforts to integrate and improve new cost allocation software introduced in December 2024, will improve the accuracy and completeness of our data. This year, we are working to integrate an even more detailed level of data at the object level in our cost allocation system. We've also improved management controls on the drafting and approval of journal entries to ensure confidence in each transaction. And as we approach closeout, our goal is to correct earlier in the fiscal year many of the relatively small errors DLS identified that could not be corrected after a certain point in the process. We will prepare a number of key documents and reports in this pre-closeout phase so that final updates are made against accurately formulated documents. For closeout reporting, DHS has compiled a list of all relevant documents and templates that DLS requested. With the submission of the JCR data and additional documentation that we provided, we are working to answer any additional questions as they arise. With that, Roman will continue to address the additional responses.
Thank you, Jessica. My responses relate to the Office of Legislative Audit's report on DHS's 2025 closeout. So first of all, DHS is continuing to work to ensure that at the end of the state fiscal year, we are appropriately reflecting what we expect to recover from the federal government. Part of my job going forward is to make sure we maximize our federal funding each year. In just 2025 alone, as already mentioned, DHS drew down more than $3 billion in federal grants. Last year, my colleagues Jessica Smith and others led an effort to aggressively ensure that we had the data and tools to ensure that we were managing our federal grants. She talked about a new cost allocation software, which allows us to do monthly and quarterly grant allocations. We, as an agency, are very dependent on these grants, and this data allows us to be successful in our eventual closing. DHS is now reviewing prior quarters and reports, looking at balances. We're making adjustments, seeking refunds and identifying any unreported activity during a quarter and not waiting till the end of the year. These are new processes being put in place. Most importantly, DHS has been meeting weekly with the Department of Budget and Management, as well as the General Accounting Division from the Comptroller's Office, to go through any issues we face in responding to these audits. Finally, thanks to the Secretary's commitment to rebuild DHS's financial function, DHS has recently hired a new budget director, Deputy Budget Director for Budget Operations, Deputy Budget Director for Cost Allocation and Revenue, and a new Senior Accounting Manager, in addition to myself, restaffing a team that was a critical piece in ensuring that DHS has the talent and capacity to meet the moment. I'll make a couple of references to the additional audit findings because I think it's important to note that we are also paying attention to any unliquidated balances and any clearing account balances that need to be reconciled. We're working right now, going back multiple fiscal years, in some cases 4 and 5 years, to ensure that we have the right and accurate clearing account figures, and we're working to reconcile that before the end of this fiscal year. We've also brought in a reconciliation specialist to help us address any special funds balances. Those are some of the things we're doing immediately to address some of the items raised in the audit. On the TANF reconciliation, let me just share a couple of thoughts. While I'm still in my first few months on this job, I see the challenge we face from the inconsistency in the federal government as a partner. Regardless, DHS does owe additional clarity to DLS on the current TANF levels. Part of the complexity in reconciling the data is that DHS has had to rely upon prior year TANF balances to sustain critical programs like the Temporary Cash Assistance Program during the long federal shutdown. Thankfully, DHS had ensured that funding was available for this very situation, and the TANF-funded programs ran smoothly during the entire federal closure. During this period, DHS remained exceedingly conservative in all of its TANF spending. Even after the shutdown, DHS has had to actively pursue HHS to get the TANF award put into place. It wasn't until January 6th of this year, over a month and a half after the end of the shutdown, that we received our first TANF award for 2026. And even then, it was only through the federal shutdown in February. I will add one note that I reached out to them this week to ask when the rest of our award will be given. They said they did not have a timeline. So we are continuing to pursue the federal government on ensuring that we have the TANF funds that rightfully belong to the state. And once we have them, we will be able to have a complete picture of 2026 and ensure that sufficient funds are available through 2027. For now, though, we know we have the funds from prior years and what we've been given in 2026 to complete that answer and get back to those that need it. Thank you.
With that said, we're happy to answer any of your questions.
Thank you, Mr. Secretary, and thank you, DHS team. I want to start by taking a moment to echo some of the concerns that were raised by our colleagues in the Senate. We completely recognize and appreciate the extraordinary challenge that your agency in particular faces every day. You all manage an extraordinarily complex system, and you support the most vulnerable people in our state by doing so. But as partners in this work, we are asking for continued transparency, accountability, and really detailed, clear communication with us and our DLS partners too. As you know, a teenager, Kanaya Ward, died last year while in state custody, and it cannot be stated enough what an unimaginable tragedy that was. And I know, Mr. Secretary and team, that you all share those sentiments. We really appreciate the progress that you all have made, particularly in ending the practice of hoteling children in the foster care system. It's something that I know this subcommittee has been looking at and asking questions about for a number of years as well. And so we are so grateful that we're moving more into alternate systems that can better support these particularly vulnerable children. So as a subcommittee, my request, just as we begin, is that we continue to receive from you and your team complete information as we are looking to how DHS will work to keep those in state custody safe, to improve service delivery, and your plan on righting the ship on management of your immense budget. We completely recognize how complicated the uncertainty of the federal government and the continued uncertainty places you all. And we really appreciate your work, but we just want to make sure we're on the same page with information, please. With that, I'm going to turn to subcommittee members for questions. Delegate Ruff.
Thank you, Madam Chair and Secretary, Mr. Chief of Staff, Mr. Napoli, Ms. Smith. Thank you so much for your work, for your service. And I know it's a difficult time, and we have to have difficult conversations. And so this is what we do. I want to also echo our chairwoman's comments and say that I'm a bit disappointed that there was no nuance or adjustment to your presentation from last week. I think the tenor of what the senator's feedback was warranted some audibles for this hearing today that would have given us more insight about the speed and urgency that you all are deciding to move with. And so I do have several questions. I'll try to keep them as brief as possible and not hog the mic, as I've been known to do. But I would like to get very specific, transparent, and non-equivocal answers to these questions. And if there is not an answer or the answer is not known, then we can just have a frank conversation. This is not about saving face at this point. I think the comments from Senator Augustine and from Senator McCray and even Senator Jennings were clear that, this response and even the presentation today does not answer the questions that the partners that we have, and we're all partners at DLS, are posing, and they're the ones that, as we know, equip us. So, we were here last year. There was the finding about the reversion that was found to be an error in $64.3 million from the general fund to the general fund. Other issues with shortfalls in entitlement programs, deficiencies that resulted in deficiencies, incorrect entitlement program expenditures, which resulted in us asking for you to create the report in October of 25, just last year. So can you tell us, Mr. Secretary, why the report did not address the reversions and cancellations, the TANF spending imbalance, or the special fund expenditures?
Sure. I'd like to begin, sir, by speaking to the issue of moving with urgency and saying out loud for the record something that I find surprising that people hadn't realized that was going on at DHS for decades. And so let's just begin with the value of moving with urgency. As Secretary, I have led the team to move with extraordinary urgency, but the fact is the department has been a paper-based and a manual department for decades. What was said earlier regarding the movement of our team, and specifically the Office of Budget and Finance, to, for the first time last year in 2025, fully enter its budget into the system, I find it remarkable that we are the ones who stumbled upon that for the first time in Maryland's history. The moment it came to my attention, we sat our team down and said, this is not okay. We still function on a green screen system with no way for every part of our department, each of our 3 administrations, to reconcile every single dollar with the click of a button. That's fact. That's true. And when that came to our attention, we moved with extraordinary urgency to find a way to actually reconcile that. So for example, if you were to have asked me a year ago, how do I know exactly which contracts are being spent and managed by which parts of our department? There isn't a single place that I could tell you that, sir, from the Department of Human Services. Not one. One of the state's largest multi-billion-dollar budgets. We have to go to multiple parts, not just within procurement. We go to each of the executive directors of each of the administrations and their teams. We have to go to budget, and there isn't a single place anywhere captured on a computer an answer for you. That is the truth. That is the fact of the department I inherited. And every single day since then, and every single time an issue has come up, we have been deliberate. In some cases, disciplining individuals for not following through. In some cases, making significant changes to our patterns of policies and practices that were non-existent. So when you hear Jessica and Roman talk about the fact that DHS has historically waited till the end of the year to reconcile, that is actually true. I don't know how that existed for all these years. And the moment it came to my attention, we actually put in place changes. I'll give you another prime example to get to your point of urgency and transparency. until this team prepared for the first federal shutdown, when I asked the question, where do we have in one place all of our federal budgets, all of our federal grants, and the impact and how much each of those funds for each of our DHS employees and the risk in a federal shutdown, the answer is we don't have that. We built it for the first time in preparation for the first federal shutdown. In this last federal shutdown, the one of 43 days, we put in place a process that hadn't existed before either. Every single day, Roman and Jessica have to go through a process that ultimately manages up to me to tell me whether or not the drawdowns of the federal money actually have come through, because we had no process in place for this department to have done that before. Until I learned that as secretary, because there's lots of things I don't know every day, it had not changed. It struck me as completely surprising that prior to our arrival, or mine, or his, or theirs at the department, that no one knew that for all those years. So partly getting those things together is being as responsive and moving with extraordinary urgency to get you those answers. Whether it's the shutdown, the TANF reversions, the TANF balance or anything else, all those had been manually kept in multiple spreadsheets by multiple people. And certainly, Roman and Jessica can speak their truth about their experience transitioning that to actually modernizing our technology, modernizing our policies and practices, and for the first time ever, starting July 1st of this year, with a vendor that took almost 2 years to procure, we will be able to actually have, for the first time ever, a complete budget picture, including procurements, cost, and balances for the first time ever. It took almost 2 years to get that done. I'm not blaming anybody for that, but we did it. And next year, hopefully, whoever's sitting at this table can give you the kind of clarity with greater speed and accuracy that we have been relentless on trying to get to you and our analysts when asked, and to verify that data. And Roman and Jessica, if you'd like to comment, given that your personal experience in this, please feel free to.
I would just say one very brief thing, which is I've only been on the job a little bit more than 90 days, and over half of those have been under a federal shutdown. That is an impossible task, especially with the kinds of systems we have. I will also call out one other thing, which is there's a FEMAS modernization effort that the state is trying to pursue. I cannot express enough how important it is to modernize these systems. I'm coming from 21 years in the federal government, and I'll just say it stuns me what the team has to do every day, the Sisyphean lift that they do just to get through the day and answer very, very useful but very basic questions. And I'll just also express one other bit of opinion, which is every day that I'm working to revise the scripting is a minute that I'm not working on actually answering the questions. So the last week and a half, 2 weeks, but actually really since the day I stepped in 2 weeks before the shutdown, it has been we've answered easily over 200 DLS questions since I've arrived. And I think that just shows that there is there is a desire to get it right, and that it's not an effort issue. And we have a lot of work still left to do, but we're gonna get it done.
So would that be the same explanation for the failure to report on the reconciliation of the assistance and foster care and maintenance payments that were reported to the comptroller?
Yeah, I want to just be very, very clear. We are committed to completing the JCR and all of the data that it requests. And I just want to say, but we are committed to doing that. And I'll just say that this has been a difficult task. Things like the TANF balances have been a challenge, and I'll just say an unforeseen challenge. You know, those are not things that were on the to-do list that had to be reconciled. So I don't want to express any defensiveness. I want to embrace it and say to you, we are actively working to answer these questions. But the frank answer right now is it has been more difficult than it should have been.
Understood. But as to that question, the explanation, which I hear you, Secretary, that explanation would be the answer to the question about not reconciling the assistance and foster care and maintenance payments, correct?
Yes.
Okay. And the same to the $70 million of federal funds attributed to TANF that had no cost attributed to them.
There was no disaggregation of those details previously, sir, until, and specifically, Jessica played a leadership role in transitioning to make sure that in this year, all of those details were entered. That's correct.
In the past week, since you've met with the Senate, have you guys been able to identify a specific date where you will be able to reconcile FY '25?
Delegate, as we spoke to the Senate last week, we are committed to getting all of that information nailed down by the end of this month.
No, yeah,
I know
I heard
that
that.
Roman and Jessica are working on that, sir.
Webster, I'm sorry.
Okay.
I'm just trying to ask, very specific questions, and I understand. I heard the whole hearing, right? You guys said the end of February. I'm wondering if you guys have a date at this point. That was all I was asking.
And I think, Delegate, the easy answer is we have a bunch of spreadsheets. Some of them are pointing fingers at each other, and we're reconciling the two.
So you don't have a date?
Again, sir, we're going to get it done by the end of February.
Okay. And then how much of the federal funds have been recovered of the $1.3 billion that could not be verified for accuracy or recovery by DLS?
Yeah, let me just be, I think even OLA would even say that's not exactly what the finding is. They said that there's $1.3 billion in accruals that needed to make sure that there were funds aligned against them. We were just going through the math again to respond to the Senate. They had a formal question on the record about this. We closed for the 5 documents that they sampled to make up that $1.3 billion. We validated that 4 of those closed the 2025 fiscal year in balance with no outstanding balances. We have billions of dollars that we are going to align for Q1 of this year. And we suspect that whenever we answer their question later this week, early next week, that's when our response is due, that what you will see is that all 1.3 billion, far in excess of that 1.3 billion, was delivered for the state, and every dollar was recovered. I will also point out, we were one of 6 agencies that fight this fight. So when I reaffirm my position about the need for systems that work across, this is not a DHS challenge.
Okay. Two more questions. Have you figured out why DHS did not report the $28 million penalty for the SNAP payment error rates to the comptroller?
So interestingly, it wasn't that we didn't share that information. We actually worked in partnership with DBM about this issue. There's actually literally today, as we're sitting here, a hearing that we're working on with the USDA about previous SNAP payment error rates and making sure we can course correct those and appeal the particular error rates.
I know they're under appeal, but are you saying that the report, the analysis by DLS is incorrect in that it was shared with the comptroller's office?
It's my understanding that it was.
So you take issue with
It's my understanding that it was, and if I'm incorrect, anyone can speak to it. No, not you, sir. I'm at my team.
I don't want to belabor the point. You're saying DLS got it wrong, right?
It's my understanding that we shared that information, correct?
Okay.
Delegate, if I may, I believe that this was an item of philosophic discussion between DBM, the comptroller's office, and our finance colleagues about how to report this. And again, because the liability penalty has not been, it's been assessed, but it's been appealed, it's floating out there. So the question is, from a budgeting and accounting purpose, how do you account for that number? For example, as the Secretary said, if we win the appeal, that penalty goes away. And I know that Mr. Napoli can speak to that in greater detail, and I know that there was a pages-long email and other discussion thread between the comptroller's office, DBM, and us. The easy answer at the end of the day is that $28 million for federal fiscal year 23 and 24 is reflected in the current governor's allowance. And so that is appropriately accounted for, sir.
Okay. Last question is about the fiscal year 25 budget amendment related to the 2025 closeout to increase the special fund appropriation by $20.5 million. 7.6 million of that was requested for a special fund increase from the child support offset account. But the opening fund balance was at like 80 million, and then the closing balance was at 98.8 million. And then DLS asked you guys to respond to the rationale behind that request. Have you all had a chance to put that together?
At this moment, we have not provided DLS a response to that. However, as we stated in our testimony, we do have outside assistance that is helping us to reconcile the special fund account balance. The reason why it was reported on the budget amendment as negative is because it does take prior year reconciliation, and we did have the current year revenue to substantiate our request.
Thank you, Madam Chair.
Thank you, Delegate. Thank you, team. Other subcommittee members? Madam Vice Chair, are you ready? Okay.
Thank you.
Mhm.
It would be helpful if I push my button. Thank you so much. I'm going to take everybody over to page 12, and I'm sure it's going to shock everyone what I'm going to talk about. I'm very interested, the DLS analysis, 42 positions are being removed for social services, 29 removed for family investment administration. That's a total of 71. 73 are being added for the administration. So with that, on page 12, can you please describe the reason for these changes and how the additions in the administration will be utilized?
Okay. Madam Vice Chair, the first item is, as noted earlier, there were a number of realignments within our administration, and so in this case, there are no actual decreases or increases. It's we were correcting our budgetary bits. So in other words, in years past, we may have moved positions around within the Department of Human Services. Now we've taken the time to update exactly where positions are and where they belong. And that's in addition to the earlier noted voluntary separation program items. So again, this isn't aside from the voluntary separation program reductions at the beginning of fiscal year 26, everything else was purely administrative.
Okay, thank you so much.
Thank you, Madam Vice Chair. Thank you, team. I have a question. If you look to page 11 of the DLS analysis, please, you all probably know where I'm going to go with this. I see the TCA collections under child support is significantly increased in 27. Can you speak to what that's attributed to? So this is, as I recall, and maybe I'm mistaken in my recollection, but I don't think I am, this is the individuals who are on TCA, child support payments withheld from their...
Madam Chair, I know the distinguished counsel flagged this for us. I don't have an answer for you. We will get back to you after consulting with our child support colleagues.
Okay, great. So just as you are preparing your response, please, so I see there's about a $1.7 million increase there, and I recall last year when we were talking about what the purpose of these dollars are that are withheld by the state, that a large portion, if not all, were used for the employment training for non-custodial parents. So I see on page 9 of the DLS analysis that there's an increase of 600 to that versus like 1.7 million in the total collections projected. So I'm just curious where the balance will go.
Again, Madam Chair, we'll be happy to follow up with you. We don't have that immediately on hand.
That's fine. And I just want to plug again a quick thank you to you all and your team on working with us on the child support pass-through bill, which I anticipate and truly hope will reduce the amount of TCA collections next year to ensure that folks who are receiving their child support benefits are able to get it.
Absolutely.
Any further questions from the subcommittee? That's it for now? Okay. We know we have many subcommittee hearings with you all going forward. We appreciate your partnership and the answers to the questions you've provided today, as well as the follow-up. We will dive into the budget further in future subcommittee hearings with you, and we'll be in touch. Thank you very much. This concludes the budget hearing for the Department of Human Services overview and our budget hearing today. Thank you all.